Welcome back. Hi, this is Mary from Straight Talk About Health and Wellness. My name is Mary Henderson, and I am your host. I want to thank you for being with us today. All right. I want to thank you for inviting us in your kitchen, your living room, or wherever it may be. All right. Or wherever you are in the world. We appreciate it. All right. Today, I'm really, really excited, you guys. All right. Let me put my glasses on. When you get a certain age, you need these glasses. And they're not cute, but what can I say? All right, today I'm excited because I am going to welcome Dr. Gina Tizio. Hopefully I got that right, you guys. She is a dedicated physician who brings valuable insight into the natural approaches of well-being, health. All right. So, to some of you do not know the difference in doctors today, you're going to find out today. There's the naturopathic one, and there's what's the other one I should say? The medicine one, for lack of a better word. Okay. Western medicine. All right. And today, hopefully, you'll choose what is best for you. All right. Just a little reminder that reminded me that this show do not take the place of your healthcare professional. All right. Or your provider. All right, which means what I'm saying is that the person that manages your health, this show do not take the place of that person. If you do have some concerns today or something that you don't quite understand today, all right, have that conversation with the person that manages your health. All right, and that'll be great. So, I'm sure you'll learn a lot of stuff, a lot of things I should share. I shouldn't say stuff, but a lot of things and information that you can use in your daily life. All right. So today we're going to have this conversation about wellness prevention, okay, and living your best life. Okay, who said that? Who sings that? Living your life like it's golden. I think it's Jill Scott. So today you're going to learn how to live your life like it's golden. We're going to welcome Dr. Gina Tizio. Did I get that right? Hello,
Excellent job,
hello.
Mary. You got this.
Hello, hello. So happy to see you.
So happy to see you too. Thanks for having me on. Would you like it if I could tell you a little bit about myself?
That'll be great. That was my next question. You're good at this. That was my next question.
You are too. Thank you. So, it's funny. I just recently opened Arizona Endocrinology of Tempe, and I did my first little reel on YouTube yesterday, so it's fresh on my mind. It'll be
Wow.
certainly easier talking to you than trying to talk to myself. So that'll make it easier. But when I was a child, my mother was in nursing school and
Mhm.
she kept all of her nursing textbooks in our living room. And being the curious child that I was, I would get into her books.
Oh,
And I
okay.
read every single one of her nursing textbooks,
What?
cover to cover,
Uh-huh.
and just was intrigued by medicine and just gobbled it all up as much as I could, got as much of it into my little brain as I could. I'm 9 years old reading these adult textbooks for fun.
Uh-huh.
Um, and that blossomed a love of medicine and in me. My mother is a reader, and so she at a very very young age instilled the love of reading in me, and so that I think really contributed a lot to that intellectual curiosity. So that eventually led me into medical school. And while I was at ASU working on my BS in biochemistry, and I got also degrees in business and psychology,
Mhm.
I was involved in a couple of the pre med groups on campus. And one of the groups, we had a group of naturopathic medical students come in, and I was studying for the MCATs. It's a very strenuous test. It's the
Mhm.
first test that you really start taking when you're getting into to being a doctor. And I was spending hours writing these dioramas and diagrams to try and remember all this information I had to know to take this MCAT. And because I was spending hours and hours and hours a day writing, I had developed carpal tunnel. And it's interesting because I don't have carpal tunnel typing. I can type all day long and it's not a problem. Thank goodness, because that's mostly what I do now and very little writing. But I was spending hours writing all this out, trying to get it in my little brain. And the pain was so bad. They were wanting to do surgery. And so
Oh, that's a mean pain,
they,
though.
excuse me?
I said that's a mean pain, that carpal tunnel.
Yes. And so they came in, they did one treatment of acupuncture on my hand, just my hand. They didn't even
Mhm,
do an extensive treatment. And the
mhm,
amount of pain relief I got blew my mind. And
mhm,
so I said, okay, let's do this. And so I went through medical school. I passed, I did all, you have series of licensing exams that you have to
mhm,
take, and just to prove that you are knowledgeable and that you know what you need to know to be a doctor.
mhm.
And then part of my journey to Arizona endocrinology actually goes back even a little bit further than that. When I was a child, and I shouldn't say child, more like teenager, I started struggling with severe fatigue. And so by the time I got into college, I worked full time and went to school full time. So yes, it was a lot, but I always made sure I was drinking my water and I was eating healthy for the most part. I mean, as well as a college student eats.
College students' salary. Yeah.
and so
Oh my
I
goodness.
would go to the doctor and tell the doctor, look, I'm tired. And all my other friends are out, on the weekends, they go out and have fun. And I
Mm-hmm.
do my work and there's nothing left over. There's no social life. There's no time for me to, then definitely no energy to exercise. That's just out the
Mm-hmm.
door. It was impossible. And after becoming a physician, looking back, I had every symptom of hypothyroidism. Not to
Oh.
mention, even the men on my maternal side of the family have
Mm-hmm.
hypothyroidism. And what I've learned since is that if your dad has hypothyroidism,
Mm-hmm.
chances are you have hypothyroidism. It's
Good to
unlikely
know.
because that's
Mm-hmm.
that's how it gets passed down through the line. The thing is because I was relatively healthy, I was drinking enough water
Mm-hmm.
and I was eating, a right amount of calories with vegetables
Mm-hmm.
and protein and, all the right combination of macronutrients. My diet was good. Um, my sleep was good. They would, so when you're, especially when you're young, your body usually can compensate for things.
Mm-hmm.
And the doctors would run tests and every single time they'd come back, everything's normal, there's nothing wrong with you, everything's normal, you're just fine. And so it wasn't until I was in naturopathic medical school that I went to a doctor and they're like, yeah, your labs are fine, but you have every symptom of low functioning thyroid.
Mm-hmm.
And it's like no wonder, because I started noticing symptoms as a teenager when my health and my vitality, that's when you're at your peak. You are the strongest when you're 17, 18,
At
19,
that
20.
age.
Yeah, the
Yeah.
late teens, early 20s, you're never going to
Mm-hmm.
be as strong and as vivacious
Mm-hmm.
and as dumb as during those years. And and so the physician said it because you have all those symptoms, including a low body temperature. That's another
Oh,
thing that's pretty
really?
significant
Oh,
for
that's another
hypothyroidism.
symptom.
You're cold
Mm-hmm.
all the time. It doesn't matter.
Really?
You could be in a warm room and you're
Mm-hmm.
cold, and everybody else is like, oh, yeah, I'm fine. But you're like looking for a sweater. Or you're the first person who will put a sweater on when the air kicks on. So
Mm-hmm.
they treated me for thyroid, and it was crazy because all of these problems that I never knew I even had, I just
Mm-hmm.
thought they were normal. I didn't realize that they were signs of hypothyroidism. So a lot, and all those signs that I wasn't functioning as well as I could
Mm-hmm.
cleared up and went away. It made school a lot easier because I really did struggle in school because part of having a low functioning thyroid is your brain just doesn't work
Hmm.
quite as well. So it was a real struggle, but thank goodness I got that. And then I got the opportunity to open this office.
Oh,
But for
nice.
the past almost
Hmm.
2 decades, I've been helping people who
Really?
don't have health insurance get affordable medical
Oh,
services
really? Uh-huh.
as a not for profit, volunteering for that. And
Hmm.
the number of people I come across, like people would come in and say, hey, I need a refill on my SSRI. And I started asking them questions just because of my experience. And
Hmm.
so many of them have hypothyroidism. We get
Really?
them on thyroid medication, and all of a sudden, things like anxiety and depression, fatigue, so many symptoms that they have just
Hmm.
resolve. Uh, and there's other symptoms that most doctors don't even attribute to thyroid conditions, uh, such as I had my little toenail
Yeah.
has this little hangnail. I've had it since I was a little girl. It's just
Uh-huh.
always, and it catches on things. It catches on the bed sheets. You're sleeping in the middle of the night and
Oh
you
my
jerk awake
goodness.
because
Uh-huh.
it catches and it's painful and it's
Yeah.
bleeding. And
Oh,
when I started
I'm
taking
sorry.
thyroid
Yeah.
medicine, it went away. I haven't had it since.
Really?
Yes, and it's just minor little things like that where if you do not have on board the
Mm-hmm.
nutrients you need or thyroid that you need, you might not even realize these little things that you're like, yeah, whatever. There's my little friend for life.
Oh my,
It
so
just
you
go
just,
away.
yeah, you learn to accept it, I guess. Like
Mhm,
this is part of me. Oh,
mhm.
wow. You
And
start, that's a very interesting story. It's interesting you started with your mother, you know, your mother, she, brought books and you was in that environment of the books and nursing books and nursing program. Oh my goodness. That's very interesting. Now, what exactly is a licensed naturopathic physician?
so, like I said, the first time I ever heard of naturopathic medical doctors was when I was in that pre med group at Arizona State University. And I didn't know what they were either. And we are only licensed in about 25 of the 50 states right now. So
Really?
it's
Hmm.
still part of it is we all the schools got shut down in the early 1900s, and so the profession almost just disappeared off the face of the earth. There was only one medical school that was able to survive. They reopened during the 1960s, and from that we've started to see a rebirth of naturopathic medicine in the United States. So like I said, I was studying for the MCATs. So the requirements to get into naturopathic medical school are the same rigorous requirements that you will see for MDs and DOs. And it includes several years of undergraduate sciences. And then you take your licensing boards, and then you apply to naturopathic medical school. And if you get in, then you go through your basic sciences, and this is the same setup as they have it with MDs and DOs. You do your basic sciences. It's usually a 2-year program, but you're also, in addition to learning all the things that they learn, you have to learn a whole bunch of other modalities. So, in addition, like your anatomy and physiology, physical examination, pathology, laboratory studies, you're also going to learn pharmacology. You're going to learn Chinese medicine or acupuncture. You learn botanical medicine like herbs. You learn hydrotherapy, which is a treatment all of itself that uses water as its main
Okay.
modality.
Mhm.
We learn mind body medicine, which is somewhat similar to counseling.
Okay.
there's the list just goes on and on. We also learn manipulation, like what chiropractors do,
Mhm.
except it's a little bit more specialized to naturopathic medicine. There's slightly different, but it's still moving not just soft tissue, but also your bones to put things back into alignment. Because that's really at the core what naturopathic medicine is it's about balance, it's about alignment, it's about putting things back to how they were. Homeopathy is probably one of the my favorite modalities. I don't use it as much as I'd like, but that's another conversation. I could spend a whole hour just talking to you about homeopathy. So maybe one
Uh-huh.
day you'll allow me the
I will.
opportunity to
I
do that.
will. My
I
students
would
will
be
love it.
grateful.
My students will love it. I'm glad you are explaining that because I have designed a program, Healthcare Career Success, and
Wow.
I go through all of the roles in the healthcare field. They're for people. This course is for people that want to get into the healthcare field but do not know what path to take or what to do. So I'm really glad you explained that because some of my students may be looking today.
I
So,
love it that you're doing that because I feel like when I was getting into medicine, I just all I knew about were there's nurses and doctors. That's all I knew. There's nurses and
mhm,
doctors. And
yeah,
there's so many hundreds of diversified professions
it
within the
is.
medical profession. That's
Mhm.
brilliant. You're doing that. Thank you so much for serving our community in that way,
Well,
Mary.
thank you.
Mary.
And you too. You too. My goodness. I'm here with a celebrity. I am. So thanks for explaining that to my students. That's great. That's great. So, how does naturopathic medicine differ from conventional medicine?
So one of the differences is that we don't get matched for residency after we've passed our licensing boards. Because of that, in the world of insurance, health insurance,
Hmm.
they consider us mid-level providers because we
Really?
don't do that residency. And it's a
Oh,
shame because
let me write that down. I'm taking notes from your
thank you. And it's
from
a
your
shame that
lecture.
they don't allow us to have residencies primarily because you do spend 2 years under the direct tutelage
Mhm.
of a physician. When I was in school, I actually ended up doing a little bit more than that just because I wanted to get as many credits as I could possibly. And I would start seeing patients at 8 a.m. in the morning and I would go
Mhm.
until 10 p.m. Monday through Thursday. And then Friday, I would start at 8 a.m. and go to about 5 o'clock. And then on Saturdays, I would start at 8 a.m. and I would go to about 1 o'clock. And I did that for 2 years straight. And we get like 2 1 week breaks off between. So you can consider how many hours I've spent seeing patients
Thousands.
with a supervising physician watching my work, giving me
Hmm.
feedback. And it's at every level, but most of the time it's me acting as physician and then presenting to my attending and
Hmm.
saying, you know, this is Mary, a 25-year-old woman who
Oh,
presents
I
with
wish.
a beautiful smile. and,
I would
and
never see
these
25 again.
yeah. And these are her concerns. Well, you look it, so I gotta go there. And and so we go through, the medical history, and then
Uh-huh.
part of the physician part of it is we sit there and we talk about, okay, well, these are the differential diagnosis, and that's
Hmm.
probably the most important part of being a doctor, is
Hmm.
we constantly have to run through our head. Unfortunately, when that's part of the reason why it's so bad to try and use Google as your doctor, is Google doesn't understand how to do a differential diagnosis. And so say you're having joint pain, There are over a
Yeah,
hundred different types of arthritis. So if you're
they
having
are.
joint pain, which arthritis is it? And it matters because you want to make sure that, we don't, and you could feasibly go into a doctor and somebody who's not really, they're unfortunately, and I'm not saying all
Mm,
doctors, but a minority of doctors out there, oh, your joints hurt, here's some Tylenol. Take
yeah.
Tylenol when it hurts.
Mm-hmm.
And it's important and it's ideal to nail down what type of arthritis it is. Like, for instance, if it's because you have high uric acid, for instance, that's
Mm-hmm.
a very different pathology and should be
Mm-hmm.
treated very differently than, say, somebody who has rheumatoid arthritis or somebody else who has osteoarthritis. The underlying cause of each of those is very, very different. And because the cause is different, the treatment is going to be different. And so that's another thing that you really learn when you're sitting underneath a supervising physician. And later on, I'm going to get into talking about naturopaths versus a
Mm-hmm.
naturopathic physician. They're two very different things, and you cannot think that they're one and the same thing because they are very different.
Can they work together?
So, as a naturopathic medical doctor, I probably would not engage with a naturopath, and I'll explain why later.
Mm-hmm.
So, so our education is very our during medical school, it's very similar to what an MD or a DO does. We also learn things like minor surgery and pharmacology and other the types of things that an does. In fact, in the state of Arizona, my scope of practice is very similar to the scope of practice of an MD. The difference though is that I actually can perform a whole lot of other modalities that they have not been trained or learned or studied. And so, for
Mm-hmm.
instance, I have when I open my tool, when they open their tool bag, they have a certain amount of tools that they can use. They can do pharmaceutical medications, they can do over the counter medications, they might prescribe like OT or PT, some kind of physical therapy. They can refer you to like a surgeon, for instance,
Mm-hmm.
but there's a certain set of things that they can do, and those are the things that they do. And there's also diagnostic exams and laboratory studies and that type of thing. But if you come and you sit down and talk to a naturopath, and I'll be honest with you, as a naturopath, this is something I struggle with because we
Mm-hmm.
can sit down and say you're coming into me and you're having some gastric problems. Well, depending on what day you get me,
Yeah.
I may want to talk to you about doing hydrotherapy as a
Mm-hmm.
modality for the stomach
Mm-hmm.
problems you have. And one thing I'll probably always talk about, almost always, is diet.
Mm-hmm.
Diet is fundamental. And as you get to know me, you'll hear me talk about what we eat over and over again. Most people, when they hear the word diet, they automatically think, oh, I have to reduce my calories. Oh, I'm gonna
Oh,
I'm gonna have
yeah.
this carnivore diet, so I'm only
An
gonna
ugly
have beef,
word.
salt, and water and nothing else.
Uh-huh.
Which, please don't do that. Beside the point. Or
Yeah.
I've got to be on this thing where I'm restricting. I'm gonna only eat this much food 2 times a
Yeah.
day, and I'm only gonna do it within this window. But
That's a harsh word.
it, so it doesn't matter what your
Mm-hmm.
diet is. We're all on a diet. If you're not on a diet, you're dead because you're starving to death and
That's
going to
true.
die. so,
That's
so
true.
we're all on a diet, but there are weight
Uh-huh.
loss diets, for instance. So one thing you'll always find, and I think most naturopaths, not all of us, but most of us, we focus a lot on what you're putting in your mouth because
Mm-hmm.
assimilation is the number one key to health. And you'll see that there are other things that are obviously very fundamental, but especially here in the United States, what you put in your
Hmm.
mouth has one of the biggest, there's also stress reduction, there's exercise and sleep and sun exposure, but diet is where so many people, in fact, it's so bad. We actually have an acronym for the standard American diet, which is
Really?
SAD, Standard
It's,
American Diet.
oh,
It's
okay.
sad.
Yeah.
It's sad. It really is because people don't eat enough vegetables. They don't eat enough meat. In fact, this is the thing that I've found profoundly interesting as a physician is that it is easier to sit down and talk to a woman about some horrible, horrific, horrible thing that happened to her, traumatic event. It's easier to talk to her about what happened than it is to talk to her about what she puts in her mouth.
Oh, that's not
It's a
good.
much, yeah, because
Oh.
people are like this with their diet.
Hmm.
It's like, this is my diet. This is what I'm going to choose to eat, and this is what it is.
Comfort
And
zone
and
though
so,
too. Comfort
excuse me.
zone, I think. I think a comfort zone for some of us.
It's fair. It's like I said. It seems to be even more personal to us as a people than some traumatic event, something really horrible that happened, some bad thing. So, anyways, going back to how we're different from MDs, DOs, a lot of the times, and I think part of it is that current day MDs and DOs have gotten to the point where they are so limited in the amount of time they can spend with you. It's almost impossible in the 3 to 7 minutes that they have with you to convince you how important it is to eat a proper diet. And so I think part of it is, even though some of them know, and unfortunately some of them don't really know, I don't want to talk negatively about it, but
Oh
the
dear.
majority of doctors understand the importance of vegetables and meat and complex carbohydrates and that
Mhm.
type of thing. So again, that's another modality. We probably spend, I don't even know how many classroom hours just going over every single vitamin and macronutrient and the
Really?
importance of it. And we have almost the same amount of biochemistry and clinical nutrition as a registered dietitian does. In fact, it couples really well with dietitians. And so we learn a lot more things that MDs and DOs don't learn about, but we also
Yeah.
don't ever have to perform like major surgery. And when I say major surgery, I'm talking about general anesthesia.
Mhm.
So that's something that we don't do. Most of us don't have an interest in doing. Our interest as far as surgery goes is what can we do to prevent you from having to have a surgery.
Yes.
And it's things like stem cells. I'm very excited that soon we're going to be
Oh,
offering
really?
stem cells
Okay.
in our clinic.
Mhm.
And I'll tell
Really?
you what, if you need knee surgery, if you need a total knee, find a doctor. I mean, it's worth the money. I mean, insurance won't cover it. They will not cover a penny of it. But to avoid going through that and just to get a few little shots in your knee instead of going through a total knee, to me, it's worth every penny.
Oh,
Some people, they want to use their insurance, and that's part of the reason why we opened Arizona Endocrinology is we're also trying to find ways to try and open the doors to people who really
mhm.
want to use their health insurance, and so try to
Yeah.
get back to some of the fundamentals. So going back to the difference between MDs and DOs, uh, they can do major surgeries. That's not something we really do. We don't do as much emergency medicine as them. I always joke with people. I'm like, if somebody is needs emergency care, I know enough to stabilize them and point at somebody and say, call 911. But the thing is that's
Mhm.
exactly what an MD primary care doctor will do. Stabilize them, call 911, get them into an ER doc because that's what they do. And
Yeah.
so we are licensed as primary care doctors.
Mhm.
And so our scope is very consistent with an MD primary care.
If someone wanted to change and, stop taking all this conventional medicine and move to the naturopathic doctor, how would they do that?
So, one of the most important things I can tell you is don't ever stop taking a medication that a physician has prescribed for you. I work very closely. That's probably been a good 10% of my practice, maybe even more, of getting patients in who have gone what we call the allopathic route. DOs and MDs, we consider allopaths. And when they come in, I usually will give them two choices. I say, I will be very happy to work one on one with you in conjunction with your MD or DO. We can do that, or I can take over the care. And if somebody is really their primary goal is getting off of medications, it is something where I pretty much will say, look, these are the things you have to do before we're even going to talk about coming off your meds. Because if you're not going to put in all the hard work that it takes, I'm not going to risk your life or your health by just taking you off meds. And so that's probably really important. The most important thing is making sure that you don't just stop your medications. And I can't tell you the number of people who are like, oh, I found this herb and I'm going to start taking that and stop taking my blood pressure medicine.
Oh dear,
Please,
you don't want
please do
that.
not ever do that. Please, I beg of
I
you,
know.
do not do that. There are herbs that we can use as a naturopathic physician to
Hmm.
get people off, but you have to be in a state of health that's where you're at, where you can just use botanical medications. And if all the other lifestyle stuff isn't there, like forget about it. And that's not always 100% true. There are some people who have essential hypertension who will have to be on blood pressure medicine the rest of their lives.
Yeah,
But
unfortunately.
maybe we could lower the dose and get them a lot closer, get them a lot more stable,
Mhm.
and get to that point. uh and it really depends on the person, and there's not a one size fits all. And and there, I will tell you, I thank God that we have allopaths. Some people think that as naturopaths we're just butting heads. I don't see that. I see that as we have very clearly defined rules.
Mhm.
And I will tell you what, if I need open heart surgery, do not
Mhm.
give me an herb.
That,
Don't give me vitamins.
I know that's not a good idea.
I that's they have their place in our world. We need them. They're very important.
Yeah.
And so so when I have somebody who has major structural changes in their body and say they need a
Mhm.
cardiologist on board, there are going to be times where I will not work independently without an MD, only
Mhm.
because we need access to the things that they have access to that I don't necessarily have access to. They have
Okay.
denied us hospital rights. I
Uh-huh.
know more and more naturopaths are now getting hospital rights. And
Hmm.
that's important because if I have a patient coming in who needs to be admitted into the hospital, I can't do that. However, an MD can.
Oh,
And
got you.
again, it kind of
Hmm.
goes back to that whole they see us as mid level providers, but it's typically in regard to things like health insurance,
Hmm.
especially HMO coverage and that type of thing. Also, HMOs, actually insurance for the most part, doesn't cover wellness or preventative type
They
services.
don't. Mm-mm.
And so that's really where naturopaths kind of fall into is
Hmm.
we don't want you to get to the point where you need to be hospitalized. Like as your doctor, I don't feel like I'm doing a very good job if you have to end up in the hospital. If you but sometimes you're so sick by the time you get to a naturopath. It
Nothing you
happens.
can do. Yeah.
Another time that's really important is if you're a cancer patient.
Hmm.
You do have a choice to not work with an oncologist, but I always highly encourage patients.
Oh,
If you want
okay.
naturopathic treatment, we want to work in conjunction with an MD. We don't want to have
Mhm.
a naturopath. The other thing is like when a woman is pregnant, if certain some of us do have a certification in midwifery, and so we
Mhm.
can handle you independently, but just like an MD, they don't handle women when a primary care isn't going to handle a woman when she's pregnant. You have to go see an OBGYN to make sure that you're getting the care that you need. And so there's a few times where we have to, and depending on our certifications and our license, our knowledge, and that type of thing, and every situation's different, just like every human being is different.
Sounds
Uh,
like it.
yeah. Did I
Yes.
answer your question?
Yeah, it sounds like every situation is different. It depends on the person's chemistry and what they have going on. And diet is a factor. I watched the news last night, and oh boy, all I can say is oh boy, because we have different type of meat that's coming in and things like that. So I think that's a challenge right now, though. Dr. Tizzo, I think that's a challenge. Nutrition and food right now by me watching the news last night. I had to put my glasses on.
Oh, Mary, it's getting so bad. So like I said, I'm constantly talking about food, and for the most part, when I go shopping, if this is kind of my general rule for shopping. If I pick it up and I can tell every ingredient it is by looking at it, this is pork,
Hmm.
this is chicken, this is a tomato, this is, broccoli. Not that I eat tomatoes. This is broccoli, this is rice. You know, that's probably something I'm you're gonna want to eat. But if it has like a label on it of things, chances are that's not something you should be eating. And I made the mistake. I love the Bridgertons, okay,
Uh-huh.
and I am a very tea kind of person,
I have
okay,
mushroom coffee. My
and
goodness.
and I saw this Bridgerton scone mix. And I was
Uh-huh.
like, oh man, really?
Oh my
Okay,
goodness.
it's you can have this once a year. It's not going to kill you.
Yeah.
And I take the box home, and
Uh-huh.
I made the mistake of looking at the box,
Uh,
and these scones are in the oven. I'm reading the box, and it's like contains biotechnology food or something like
oh
that. And
my
I'm like,
goodness.
are you serious? I go and turn the oven off. I throw them in the trash.
It's a-
I
oh
wouldn't even eat it because the food that they're doing nowadays, it's not even like
dear.
food that comes in a box really isn't very good for you, but at least it's like real food that's been man altered
Yeah, that's true.
versus
That's true.
whatever was in that box that I don't really know what was in that box,
Yeah,
but
but we don't know.
it's
Yeah,
not
that's
something
true.
that anybody should be eating. And I could
Hmm.
only imagine. We don't even know. And it's interesting because when it comes to medications,
Hmm.
these pharmaceutical companies spend hours and hours and hours trying to um, get they like actually it's not hours, it's years to try and get medications put through to make sure that they're safe, make sure that they
Mhm.
don't hurt anybody, make sure that
Yeah.
that risk to benefit thing is something a physician constantly weighs when it comes to
Mhm.
treatment. And with food though, it's like, oh, here, have some food we made up from something.
Oh my goodness.
And we have
You're
no
right.
idea what is this?
Oh my
And to me,
goodness.
that's just so scary. Thank you for letting me share that little scone story. I was so disappointed I didn't get to my scones.
Oh my goodness. Well, me, see, I have mushroom coffee. I
Mm,
drink mushroom coffee, and I actually like it.
brilliant and beautiful.
Yeah. Oh my goodness. Dr. Tizio, this is really a fun interview. But I am going to ask you, what are the misconceptions that people have about you? Not you personally. No, that didn't come out right.
About naturopaths. I
Yeah.
know exactly where you're going. Do you mind if I tell you a really quick little funny story before
Sure.
we go down that road?
Sure.
I'm sitting at a restaurant. We've got like probably
Mhm.
20 people here. It's one of those singles things.
Mhm.
And we're sitting here talking, and I start talking. Somebody asked me about homeopathy. And I already told you how I am about
Yeah.
homeopathy. So I'm sitting here talking about homeopathy, and I love homeopathy. I could
Uh-huh.
talk your ears off for days about homeopathy.
Uh-huh.
And what I didn't realize is that the entire conversation had just become focused only on me. The entire table had stopped
Really?
talking, and they were all paying attention to what I was talking about with homeopathy.
Uh, Uh-huh.
And I
Celebrity.
felt, in retrospect, I kind of felt bad for this girl, but I think she didn't really care for the fact that I was getting
Uh-huh.
all of the attention when she was
Yeah.
trying to talk to a man that was sitting next to her.
Oh.
And she's like, "Oh, well, what kind of doctor are you?" I said,
Uh-huh.
"Oh, I'm a naturopathic medical doctor." She's like, "No, I don't think that's the word I was trying to come up with."
Oh my
And I said,
goodness.
"Well, some people mistake me for a homeopathic doctor,
Mm-hmm.
or, a holistic doctor or something like that." "No, that's
Mm-hmm.
not the word." "Oh, I know what it is. Witch doctor." I started laughing at her. Oh, I don't think that's the reaction she was going for. So in
Uh-huh.
retrospect, I felt really bad because I would never want to be rude to somebody, even if they
Yeah.
were being rude to me. It's just not the right thing to do.
Right.
But I'll never forget, and I thank goodness that was
Uh-huh.
my reaction to her. Okay,
Oh
because
my,
I've been called a medicine woman. I've been called everything you could
really?
imagine. Oh
Really?
yes, yes. But I think being called a witch doctor was probably the funniest one. So,
Yeah, that's the funniest one. Oh my goodness. Shame on
but
them.
holistic is such a broad term. I generally, even though I am considered a holistic or CAM
Mhm.
doctor, I generally stay away from those terms primarily because people who have not done any kind of formal studies, have no kind of certification, not done any studies, they can call themselves a homeopathic, they can call themselves a holistic uh, medical practitioner. And
Okay.
some of them do very intensive. One of
Hmm.
my dear friends is right now working on becoming a yoga instructor,
Oh,
and
really?
and
Okay.
it's very intensive. There's a lot of coursework. There's a lot of things you
Hmm.
have to know. Yoga is a very amazing modality. It can be very healing.
Hmm.
Again, please don't do yoga if you think you're having a heart attack. Go to the ER.
Oh dear, don't do that.
but but and I have so much respect. There are a few botanical medicine uh, practitioners that I know that they blow my mind when it comes to their knowledge about plants and herbs and the pharmacology, and how to just balance a tincture just perfectly, and what constituents are in the medication and which ones act, and what happens if you're doing a standardized extract versus there's a lot of information and knowledge. And even though that's just one of the things I do, that's a whole field of study. And it is certainly
Mm-hmm.
considered holistic. And the problem with it is that there are certifications, but anybody can walk in, and there's this lovely herbal shop down the street from my house. I've known the owners for many, many years, 20 years or so, and I've volunteered there, have a very good working relationship with them. But they do like a little class. You pay like $1,000 and you sit in your little class, and it's a couple of sessions.
$1,000?
Uh-huh. And then
Mm.
you can come and volunteer in the shop once you
Oh,
take the
okay.
class, and they do a
Mm-hmm.
little bit of medicine making, and honestly it's like the difference between a CNA versus a nurse practitioner, the difference in level between somebody who does something like that versus some of the herbal practitioners that I know. You can't even really, but I mean, it's true of anything where there's a vast amount of information to know. And, I sit somewhere probably, if this is a medical practitioner who's been doing this for 60 years and
Mm-hmm.
somebody who took $1,000 course that was a week or so long, I probably sit a little bit closer to right about here in my knowledge
I
base,
think so.
but
Yeah.
you can see the wide continuum, and there's
Mm-hmm.
not really any standardization. Even if they have some kind of certificate, how good is the study? So so I did want to bring up something about naturopaths that you brought up. So in the state of Arizona, if somebody
Mm-hmm.
calls themselves naturopathic, it is legally a legal term in Arizona. It is a protected term. You If you are a naturopath, you cannot say that in the state of Arizona because it's against the law unless you've actually gone to naturopathic medical school and you've passed licensing boards. That is the only way to call yourself a naturopath here in Arizona. Unfortunately, I've come across a lot of people who don't have a very good understanding of what naturopathic medicine is. So I'm so grateful for you allowing me to kind of clear up the air and
I
talk a little
appreciate it.
bit about this today,
Oh, this is
because
great.
I've had people come to me and they're like, "Oh yeah, my doctor's a naturopath. My doctor's a naturopath," and then I
Mm-hmm.
find out that they're actually an MD.
Oh, yeah.
They're not a naturopath. An MD cannot say they are a naturopathic doctor. It is against the law, just like it would be against the law for me to go perform open heart surgery. It's against the
Yeah.
law.
Mm-hmm.
And they shouldn't be practicing naturopathic medicine just as much as I shouldn't be performing open heart surgery. And so there are a lot of graduate programs that you can
Mm-hmm.
go to online. And,
Online,
you
huh?
go and you take some classes online, and they might even be a couple of years. They might be thousands and thousands of dollars, but you
Mm-hmm.
don't ever. The most important thing and the biggest problem we have as a profession with naturopaths
Mm-hmm.
is that they do not ever see patients under an attending physician. I told you how many hours I've spent seeing patients being overseen by a seasoned
Unattended.
naturopathic
Mm-hmm.
physician, somebody who understands
Has the
differential
experience.
diagnosis
Mm-hmm.
and has experience and has knowledge, who is licensed to practice naturopathic medicine. And unfortunately, I really blame the schools. I understand they just want to make a few bucks,
Mm-hmm.
but there are these people going out and they're becoming naturopaths and paying all this money, And then they call themselves naturopaths, but they're not. And I mean, it's gotten so bad, like in the state of Florida, because and I'm I probably should leave this one alone. In the state of Florida, naturopathic medicine is not recognized. If I go there as a licensed physician and set up shop and say, "Hey, I'm a naturopathic medical doctor," even though I'm
Mm-hmm.
licensed in Arizona, I could go to jail for practicing medicine without a license.
Mm-hmm.
We are only licensed in 25 states. We have been working very hard as a profession to get licensed, not just in all 50 states, but in also all the territories. And only once we do that can we really get any kind of structure or understanding and protection for our profession. Because unfortunately, you can talk to
Mm-hmm.
a naturopath who's didn't pass licensing exams. They've never been overseen by an attending physician, and they're dangerous to our world and to our community, primarily because most people don't know the difference between a naturopath and a naturopathic medical doctor. They're two very different things, and they should not be confused.
Oh, no, they're not. So I hear an echo. But anyway, it's just like nursing. All right. If you move to another state, you need to be licensed in that state. Okay. So you can practice to be a RN or whatever the healthcare profession that you want to be. So the same with you. If you move to another state, you need to have license to practice in that state. You can't just go
Yes.
willy-nilly and just go and say, I'm
Yes.
gonna set up practice. Interesting.
And I don't know enough about how it is with DOs and MDs, but I also know with attorneys too. You have to pass their licensing boards in that state. So
Interesting, interesting. How can you help the patient create a lifestyle that they can maintain?
you have to make a decision that that's what you want. And I remember it when I went to naturopathic medical school.
Mhm.
It was life altering because I didn't even realize, like for instance, I don't know if you've noticed that I'm drinking out of a glass jar. Most people drink out of plastic bottles.
Yeah.
Plastic bottles contain a ton of endocrine disruptors.
Oh
They're really
boy.
bad for you. There's, eating, and I've already kind of talked a little bit about diet, how important it is if you can look at the food and know exactly what it is without reading the label. Chances are, and that's not 100% true, but for the most part, it's true that you look at broccoli and broccoli is broccoli. There's no red dye yellow in it. There's no red dye 40 or there's no MSG. I mean, it's broccoli. Broccoli is broccoli, you know. So,
Yeah, right,
I
right.
mean, you still are going to deal with the herbicides and pesticides in organic versus regular, but that's another topic for another day.
Okay, I'm really enjoying this conversation, but I need to ask one question before I let you go today. How does this help women that are in menopause or perimenopause?
Mary, that's a loaded
Deep breath.
question. And you, you really need to you need to find somebody who's a licensed medical doctor. I think the one thing is I don't think that naturopaths, as far as I know, ever call themselves physicians. And so uh, them finding a naturopath, a licensed naturopathic medical doctor or a naturopathic doctor
Mhm.
is really the key. They can kind of lead you through that and talk you through that, and it's not, and that's one thing that can is very different about my profession. It's not,
Uh-huh.
if you have blood pressure, you take a blood pressure medication. It's not really how it is in naturopathic medicine. And every person gets kind of their own treatment, and every practitioner is going to treat it differently. So if you say you present with menopause and you go see one of my friends whose main modality is botanical medicine, she's probably going to want to put together a tincture for you. And again, we're still probably all going to talk about diet. I might personally say, well, here is some medication. Here's a homeopathic medication that I want you to use. And that's the way I want to do it. And then you could go to somebody else. And, one thing about Arizona endocrinology is we're doing more hormone replacement therapies.
Oh,
So
okay.
we do the estrogen, progesterone, testosterone, and it just depends on what you need. And the only way to find that out is to sit down, do an intake, talk to you about what your symptoms are, and then use laboratory studies to kind of get the full clinical picture. And then, it's an they talk about medicine also being an art, and it really is, because what's going to work for you isn't going to work for the next woman sitting right next to you who may have the same labs, or she may have the same symptoms. It could be possible she had the same labs and same symptoms and still need something slightly different from you.
So things
And
have
so,
changed. Things have changed with the hormone therapy because it used to be a hormone therapy may be a possibility that you will have cancer.
what you're referring to is there was a huge study many years ago, and in the study they were giving estradiol to women
Mm,
and not giving them progesterone. And if you have a uterus and you're taking estradiol and you're not taking progesterone, it is it can it's like putting fuel on a fire when it comes to cancer. And I mean, it's the same with testosterone. If a man has existing hormone driven, and it doesn't matter if there's hormone driven cancer present, putting
mhm,
hormones on it is adding fuel to a fire, but it does not cause it. But because they were seeing so many women get breast cancer,
mm.
they just automatically they stopped that study. They didn't even finish it. They stopped it.
Really?
So many women were
Hmm.
getting breast cancer. They just stopped. And
Hmm.
now a lot of MDs are starting to realize that that's just not the case, that they need to do both together. The problem is that they're years behind because they haven't been studying it and practicing it. Like I said, this is there's an art to it. And one of my girlfriends, in fact, just posted the other day. She was taught, we have private groups, and she said
Hmm.
she got a patient whose testosterone was 949. That's
Mm.
acceptable for a man. In a woman, that is unacceptable.
Too
And
much.
so you really need to find somebody who knows what they're doing, has had proper training, not somebody who's like, okay, I'm going to just try this out on you. Because
Hmm.
the side effects, the virilization, the things that happen, it's a
Hmm.
lot, and it can affect you. And it can affect you long term, and some virilization can be lifelong. So it really is important to find somebody who's well versed in that. And that's kind of why
Hmm.
with Arizona endocrinology, uh, we have will we're going to be focusing on practitioners who this is not their first rodeo.
Good seasoned experienced practitioners. Yeah, those are the best kind. Well, I shouldn't say that, but anyway. But anyway, I am enjoying this conversation. Some people say convo. I am really enjoying this, and I'm sure our audience is learning a lot. But everything comes to an end, unfortunately. So I would like for you to leave your last words with our audience.
The last words.
Uh-huh.
Well,
What you want to leave our
if
audience today?
if you could have one, well, can I do more than one?
Okay.
When you're looking for
Okay.
a licensed naturopath, make sure they went
Uh-huh.
to medical school and passed licensing boards.
Mm,
Probably that one. And then as
very
far as
important.
health tips goes, if you can look at the food and identify it without
Mhm.
looking at a list of ingredients, you could probably eat it. And if you can't look at it and tell what it is, chances are you probably shouldn't be eating it.
So if a chicken looks like a duck, so you mean that we shouldn't eat that, although it says chicken?
Well, and it's funny because people are going to be like, well, what about a loaf of bread? I know this is a loaf of bread,
Yeah.
but there's a big difference between eating Ezekiel bread and eating
Uh-huh.
sourdough bread and eating Wonder bread. So
Yes.
it's not the best rule in the world, but it really is all about like what does the earth produce? What is natural? What is naturally occurring in our world is food. If they ate it 300-400 years ago, chances are you should be eating it. And if they didn't have it 200-300 years ago,
Mhm.
you probably shouldn't be eating it as a
So we need to
general
leave that
rule.
alone. So we need to leave that alone. So in other words, do not eat anything you don't recognize.
And don't eat stuff that doesn't come out of the earth naturally.
Yeah. Come out
Real
there.
food.
Oh, that's a good
Real
one.
food.
Yeah, that's great.
Real food.
Oh, thank you so much for being here and taking time to be with me today. Thank you
It
for
was
your
a
service.
pleasure,
Thank
Mary.
you for
Thank
your
you so
service. I'm
much.
trying to
Thank you for what
my
you
hand.
do.
We must do this again. We must do
I
this
would
again.
love to, Mary.
Sounds
Thank
great.
you. Have a lovely day.
All right. So I'm going to sign off with everyone now. So in the meantime, you guys be safe, be healthy, and be blessed. All right. This is Mary with Straight Talk about Health and Wellness.